So because the record button's being hit right now, I just want to actually give my own territorial acknowledgement to where I am, which is at UBC right now, which is on the traditional ancestral unceded territory of the Musqueam. And Caroline gave a great one, great actually sort of prompt for all of us, wherever you're zooming in from, to think about whose territory you're living on and peoples who steward that the land that you're on, and to also kind of think about what we're talking about today in terms of where you are at locally. This was put together as a conversation out of a sense of actual perhaps foreboding, as well as curiosity, as well as advocacy about the need for data about how COVID-19, for instance, among many other things, was affecting marginal populations, racialized populations, Indigenous populations differently, and how the aggregation of data was in fact missing all kinds of processes that are the direct result of the history of white supremacy and of colonialism on these lands. And so in some sense, we brought together a set of speakers that we hope will help us all think through issues, to identify both the dangers in some sense of data collection, and yet also the need, and in particular, what that data will be in the service of. Who is it in the service of? Who will be controlling, the use of that data? Who will share in that knowledge? Who will share in the obligations of protecting the people who are, reflected in that data? And so those are some of the issues I know that will come up because of the three people that we have. I won't spend the time here to go into the data or into the bios of each of the three, because those are online at the website, but I will do very short introductions in order to allow each of them the maximum amount of time to share their thoughts. But we have, we're very honored that the three speakers today on July 9th, as well as the three speakers who have agreed to participate on July 23rd. We think that they all have incredibly important perspectives based on their own experiences, on who they are, what they've gone through, the expertise. They're all advocates in a particular manner that they themselves have shaped the knowledge that they have through basically action in their own lives and for the communities that they're a part of. And so I just want to thank them on behalf of the organizers of this event for taking part. The order we're going to go through is, just to give you that sense, is to have Avi go, and then Kim McGraw, and then Marilyn Slett speak. We've asked each of them to speak for approximately 10 minutes or so, with some initial remarks on what they think are really important points to think about. And we're going to take some time for them to be able to talk with each other and engage with each other's points. And then at the end of today's session online, we'll bring some of the questions that you have for them, and hopefully we'll have enough time to have a robust conversation. But I want to just thank them again, all three of them, for participating and for bringing their own perspectives and ideas to this discussion. So very quickly, Avi is actually calling in from from Central Canada, and she's been involved in a number. I've known Avi now for years, and she's been involved in a number of initiatives, anti-racism, commitments to communities in Ontario. And I think that's one of the reasons why we wanted her involved, was because there's things going on in other parts of Canada that there's different provincial legislation in other parts of Canada that actually can oversee things like data collection. And so we wanted to get her perspective on what's going on right now there as we think of BC and at the same time. So without any further ado, I just want to pass it over to Avi Go.
And Avi, I'm gonna stop sharing my screen, so it's all yours.
Thank you. First of all, just want to thank CCHSBC for inviting me here today. I have a PowerPoint. It's very long, but I promise you I'm not going to go through all the slides. It will be made available on the website after the event. So I'm going to share my screen right now, and I hope you can see it. Yes. Okay, so basically, I'm going to talk about this issue from two perspectives. One of them is to talk about the use of disaggregated race-based data as an advocacy tool for racialized communities. And the second point is to provide some legal basis why data can and should be collected from the Ontario experience. As Henry mentioned, I've been involved with different things, but one of the organizations that I've been involved with is called the Color Poverty, Color Change, and it's a network of agencies and individuals that have come together since 2007 to push for the issue around racial equity. We started in 2007 because Ontario government at that time was going to put together a poverty reduction strategy. And we wanted to make sure the conversation around poverty recognizes that racialized groups, including Indigenous people and other people of color, are most disproportionately affected. And of course, the collection of data becomes a very important point in pushing for that issue. So my 4 points in my 10 minutes will be here. The changing understanding from our community about the use of data. The second point is how color poverty itself has used race-based data to advance its work. I want to also look at the Ontario Human Rights Commission, their reports, and how they have used data to advance their issues. And finally, the Ontario Anti-Racism Act, which mandates the data collection in Ontario. So I have a couple of slides here, but you know what? I'm just going to very skim through it. Basically, I know that for a very long time, many community organizations are very concerned about the collection of data because they have been misused, and sometimes they are continue to be misused. One example that I put here is Julian Fantino, who was, some of you may remember, chief of police in Toronto, but also a former justice minister during Stephen Harper time. And he had called for the collection of race-based data to prove that Asian Canadians are more likely to commit crime, particularly not just all Asians, but some Asians like Vietnamese. And in particular, and mainland Chinese. And I don't know how he would be able to distinguish between those two. But anyway, so from his perspective, race-based data needs to be collected to show how bad these communities were. And of course, many people are rightly concerned about how data can be used to perpetuate some of the very negative stereotypes and perceptions, particularly around Indigenous and Black people and other people of color. So one of the main concerns always around race-based data is who controls the data, who has access to the data, and what the data are being used. But at the same time, it's important for us to collect race-based data because regardless of whether or not data exists, the stereotypes still exist. And without the data, we cannot combat the structural and systemic racism because governments always hide behind the lack of data to say, for instance, in the example of policing, well, it's just a few bad apples who are causing problem. Whereas what we're trying to show is the entire police system is racist by showing, for instance, data around street checks, use of force, and so on and so forth. And without those data, governments can continue to say it's just a few bad apples. And of course, as a lawyer, I also very interested in using data, oftentimes when we're dealing with charter litigation, because we need the data to show disproportionate impact on racialized communities. I mean, apart from the Indian Act, which is overtly racist, most of the laws today cannot be overtly racist because of the Charter of Rights and Freedoms, particularly Section 15 dealing with the equality rights. However, we know as a reality, because of systemic racism that exists in our society, the law would still continue to have disproportionate and negative impact on racialized groups. But how do you prove it? You prove it by social science data. And in fact, every time you do a charter litigation, the court expects you to bring forward social science data. Otherwise, they will say that you're not able to meet the test to show that the law itself is discriminatory. So the collection of data, particularly race-based data, is very important because as far as I'm concerned, the courts are still not able to understand how systemic racism affects our communities. So it's important for us to show it by having the data. I have a number of slides here that I don't want to go through, which talks about the color poverty and what we do, our work. But I want to highlight one particular point on this particular slide, is that for the longest time since we were formed in 2007, we have been pushing for the collection of race-based data because we think that it's by having these data, then we can then make sure there's a way of measuring and monitoring any kind of government laws, policies, practices as to their impact on our communities and their effectiveness if these measures are supposed to remediate the issue of racial inequality. The only way for us to know whether it's working or not is to have data. So I'm going to not go through the slides here, but as an example of how we have used data, and particularly disaggregated race-based data to push our agenda, is looking at the issue of poverty. And we have been using StatsCan report census data since like 2006, 2000, and of course more recently 2016, to highlight the racialization of poverty in Canada. And there's a number of slides here that talks about how people of color and different communities, because you can see that poverty rates are different among different communities. So it's not just enough to say people of color are affected by poverty issue. We need to understand the disproportionate impact on different communities because of their different experience. And so that we're, for instance, you could see that West Asian has an extremely high poverty rate of 36.1% in Ontario, versus Chinese is 24.1%, and versus non-people of color, like white population, is 11.1%. You will also notice that these slides do not include, most of the slides do not include figures of Indigenous people, because the StatsCan data on Indigenous people from the perspective of many Indigenous groups are not that reliable. And that speaks again to the issue of having communities must have trust in the data collection process in order for them to feel comfortable engaging in that process. We have been doing a lot of workshops around the province trying to address community concerns of data collection. What is speak to the value of having social data, but also try to respond to the concerns and barriers of these communities as well. And from our perspective, it's not just the government, but individual organizations should also collect data to understand better the impact of their work as service providers, as community agencies, and understanding the connection between their agencies and the communities that they're supposed to serve. So I have this, and on this slide, some of the fact sheets that you can find on our website, our data collection tools. We also have French also on our website, and also a sample collection tool. I would now want to turn to the report on from the Human Rights Commission. And the Human Rights Commission in Ontario has also been advocating for data collection. In fact, some of the changes that you are seeing in Ontario is as a result of the work by the Commission. For instance, the work that they have done about street check, based on information collected by Toronto Star. They look at how Blacks and brown people are disproportionately overrepresented around the population that was subject to street check by police. And several years ago, the Human Rights Commission introduced this Count Me In handbook, which talks about why it is that we must collect human rights-based data. So it's not just about race, it's also about gender, gender identity, and so on and so forth. And to better understand the intersectionality of racism with other identity. And the tool that I mentioned on our website, on the Color Poverty website, is also not just a race-based data collection tool, but basically looking at race as it intersects with other demographic identifiers as well. The Human Rights Commission has also developed fact sheets on data collection, which I will encourage all of you to look at. I want to spend the last couple of minutes talking about the Ontario Anti-Racism Act. Some of you may already have heard about this act. It was passed in 2017 by the previous Liberal government. And it was as a result of years of community advocacy from groups such as the Color Poverty, Color of Change, our legal clinic, and many other racial equity seeking groups in Ontario. And one of the key things that this act will do is to mandate the collection of race-based data. I have included here, just a preamble of the legislation and also the definition section that talks about that. And it's important to understand that, when we were for having the legislation, we wanted the Ontario government to collect data across the board for the reasons that I outlined previously, which is to better understand the impact of the law on different racialized communities. And so there's a very detailed set of regulations and also legislative guidelines under this Anti-Racism Act that talks about how data should be collected, what are the standards, and how to protect personal information. And you will see here on this slide that basically it is still, whatever data that is being collected by the government will still be subject to the Privacy Act of Ontario. And on top of that, it is also, nothing in the act can be interpreted to reduce any right or entitlement under the Human Rights Code. So both the Privacy Act and the Human Rights legislation would protect the information, the private information that was given by the individuals through the data collection process. And certainly that's a very important point that advocates, while we want to have more data, we also want to protect the individual privacies. And we believe that this is being achieved by the legislation. In fact, I would also add as an anecdote that we, Color Poverty, actually drafted, presented a draft legislation to the government of the day. Of course, they didn't adopt all of the provisions that we put forward, but they very much adopted the key points, particularly those points around data collection. And so the next few slides are all about data standards, what are the required content for the standard, how do you collect information, how the information can be used, and more importantly, the de-identification of personal information and also the disclosure of de-identified information. So that, because one of the idea behind this data collection is also, once the data is collected, who will have access to it? And when we first presented this idea to the government, we wanted the government to make the aggregated data. So like once the information was collected, we hope that it will be released in the form of, let's say, public information or report, as well as make it available for instance, academics to analyze the data without the identifying information of the individual persons involved. So the legislation also speaks to the issue around the identification of personal information and the disclosure of such information. And of course, very importantly, the retention and security and disposal of personal information. So, and after the act was passed in 2017, then just before the last provincial election, the government then released the regulations for the data standard, which in fact set out, sorry, I'll just go back there, which set out basically how, like, the entire model for the standard collection. Maybe I'll just go to this particular slide. So this is the data collection tool that was created by the Ontario Anti-Racism Directorate on how data should be collected by the various ministries. So as of this moment, not all the government ministries and departments are subject to the data collection. The most important sector that has not been included is the health sector. But interestingly, another anecdote, when we were a couple of years ago in 2018, we were in Geneva during the UN Committee on the Elimination of Racial Discrimination. They were reviewing Canada's compliance with the Convention on the Elimination of Racial Discrimination. The Ontario government sent representatives to attend this event, and they are all from the Anti-Racism Directorate. They present the Anti-Racism Directorate as the shining example of what the Ontario government was doing at the time to address racism. And at that meeting, the government representatives claimed that health sector would also be subject to data collection. So that came as a whole surprise to all of us, and there were not that many people from Ontario in Geneva, as you can imagine. But since the election was called, we have a new government. They haven't followed up on this. And of course, they have in fact scaled back on many of the work that the directorate was supposed to do. However, they did not repeal the act. They did not repeal any of the regulations. So even as of today, Ontario still has the law that requires the Solicitor General, the Children's Aid Societies, the school boards to collect race-based data. So for instance, in Toronto, the Toronto police have already started to collect race-based data in the context of use of force. And the Special Investigation Unit of Ontario has also, announced that it will start collecting race-based data. And I was also consulted on their race-based data collection tool as well. So it's moving forward, even with the Doug Ford government. They are not backing down on data collection, which I think is a great thing. And I would certainly encourage and hope that BC government will follow suit. Thank you.
Thank you so much, Avi. I didn't mention in their intro that Avi is a trained lawyer and a graduate of Osgoode Hall. So you can see that her remarks about the work that they've done, the organization she's part of in Ontario, this is a lot about legal issues. And just as an anecdote, before I pass it on to Kim to speak, I think one of the most common things I hear when people talk about race-based data in Canada is they make it into a legal issue about privacy, as if, you know, we just can't do it because of privacy. And so thank you so much, Avi, for actually opening up the legal angles around exactly the kind of advocacy that has been happening in Ontario and the passage of the Anti-Racism Act. I think another way that we really need to think about and consider it is in terms of research, and that's why I think our next speaker, Kim McGall, who's a professor in the population and public health faculty here at UBC. We're so glad to be able to have her speak to us about data collection as a process and her thoughts on the best ways to do it, things that have to be watched and that we need to be careful of. So I'm going to pass it on to Kim.
Okay, and did like the total 2020 thing of not unmuting properly. So thank you so much for the invitation to be here. I'm really pleased to have this opportunity, and this is a topic I've thought about more recently for many reasons, but have been thinking about for some time. So I'm really pleased to have a chance to talk about it. I'm very, very briefly just going to give a bit of context for the remarks I'm going to make, a tiny bit of history, because I actually think it's quite important to in the way that we think about data collection and use, and then talk about one possible way forward. So just for a bit of context on race-based data collection. So this is interesting that following AV now to report this. So we talk about permitting the collection and analysis of data based on race and other grounds, provided that the data is collected for purposes consistent with the Human Rights Code. This is in Ontario, such as to monitor discrimination, identify and remove systemic barriers, address historical disadvantage, and promote substantive equality. So these are like the positive reasons we really actually have to collect data about race, because how can we say anything about race and the experience of people of different backgrounds and when it comes down to it in our society, different colors, without knowing something about that. So the city of Vancouver also, this was from an article in the newspaper, so that say the Racial and Ethnocultural Equity Advisory Committee joins health advocates, elected officials, and human rights commissions across the country to say that racialized communities are at high risk of contracting the disease, meaning that COVID-19, and gathering information is critical to protect vulnerable groups. So there's a particular moment in time here where the fact that we haven't consistently collected this information means we're really, really not understanding something that has clearly emerged in other countries as quite important for getting a gauge on how the pandemic is affecting the population differentially. On the other hand, this third quote is from an article in The Conversation, which is, but the use of race data may be problematic because links between health conditions and race have been connected to discriminatory outcomes in the past. So this is not a simple thing, because these data have been and can be used as tools of oppression and discrimination. They also are essential for pointing out where systemic discrimination and oppression occur. So it's like walking on the thin edge of a sword or something like that. So if you think about there's this tension here, and so this quote, which I've known for a long time and actually didn't know the source of it, it turns out to be from Louis Brandeis, who was a Supreme Court member in the United States in the early part of the 20th century. And he says that sunlight is the best disinfectant, meaning that we have to have things like race-based information. Interestingly, the sentence that It's interesting background noise. The sentence in the piece that he wrote that just before the sunlight is the best disinfectant piece says that publicity is justly commended as a remedy for social and industrial diseases. So really what he's saying is we need the sunlight, we need the data, we need information. It all needs to be public because that's how we understand what's happening in our society, how we collectively understand that. Interestingly enough, this same person, Louis Brandeis, was one of the authors of one of the most fundamental pieces of decision in the United States called the right to privacy. This was the name of this, and really what this was the argument within the United States constitutional system about the right to be left alone. And so it is, again, this tension between, and meaning the right to be left alone as in you can keep yourself private, you don't want things to be known about you, etc. So it is, again, a bit of this tension. Now, one of the other things that I think this points out is that sometimes the sunlight applies to making things better and more accessible in a societal sense, and privacy relates to protecting an individual. So it's not only about privacy versus openness, it's about who is going to be at risk and who might benefit. So while we might fix societal things if we are more open and transparent with our data, it poses a risk to particular individuals. So it's not an even playing field or an easy thing to balance necessarily. And I mean, I think we've talked about these things already. That you really can't do what we need to do without data, but data come with a certain pointy end to them, can be used against people. So now I want to go into the history piece of things, just to talk about fair information practices. So, and what I mean by that is there's a set of principles or ethical foundations that we talk about or that we refer to when we're talking about data, including data collection, but also access, use, disclosure, and so on. Now, it's probably a really weird looking set of pictures on the left-hand side. And really what I was trying to highlight here is this is not that, it's not as old as you might think. These fair information practices really only started emerging in any meaningful way after World War II. That's a picture of the Nuremberg Trials. And I put this here because I think there's something about the rise of research ethics and these fair information practices that seem to come along around the same time, a bit as a reaction to the really horrific race-based things that happened during World War II. So there was a societal moment of reckoning and trying to rectify at least some of those things. And the reason that on the bottom there, that's actually Steve Jobs and Steve Wozniak, and part of it was the early 1970s when the Organization for Economic Cooperation and Development, OECD, actually promulgated their fair information practices, and it seems to relate to the rise of computing because of this more ubiquity of data and data collection. And so what this early era of fair information practices was the imperative to control the collection of data and limit then the subsequent disclosure and use. So if you look at the fair information practices as they existed then, they've been updated a bit since, but they really concentrate on things like, what do you need to collect? Do you have a legislative or statutory authority to collect what you're collecting? Do you actually need it? And you really shouldn't collect anything more than you absolutely need. So if you combine this history of really terrible uses of data for oppression, and that was happening in Canada for sure against many communities that we could, well, I don't need to say it in this context really. So we really concentrate on collection. Now, in the past 10 years, the thinking has been changing a little bit because frankly, we can't control data collection anymore. Data collection happens all the time. There's data being collected right now, your GPS signal is sending out notes of where you are. You've probably got apps running on your phone that are collecting data. You might be wearing a Fitbit that's collecting data. So the idea that we're going to run this world by totally just controlling the way we collect data seems like it's run its course. And so what we start to think about more now is the focus on the use of data, understanding that collection is ubiquitous, and more importantly, that context matters. So meaning that if we accept that data about us are being collected all the time, and we want to worry about who has access to those data, the context, the circumstances really do matter. And so this is where one of the emerging frameworks right now is this, what's called the 5 safes framework. And what this does is it talks about, here's the different things we might want to consider if we're thinking about who should actually be able to use data under what circumstance. Who are the people? Where's the environment that they're using the data in? What questions are they asking? What's the level of detail that they're going to take out? And what is the data that they actually need to do the things that they wish to do? So it is I hope it's apparent why that shift could be fundamentally change the way we think about how we want to work in the future in the world of data collection. So one of the things that makes data collection so problematic, so we're talking now on the negative side of things in the race-based data world, is that there's this very strong history of race being used as if it's a biological variable. I think Avi really alluded to this, that we look at Black people versus white people, we look at Asian people versus Latino or Latinx, however you want to do the comparison, and then conclude that people are different and therefore it's down to their biology, and race then represents everybody who has that same background. In fact, I think if you talk to anybody who actually thinks that race is a biological variable, maybe we should just like close the conversation and move on, because that is, it's just so outdated, wrong, and I guess we should just say it strongly. Race is really it's a social variable, culturally constructed, and we have to be really careful to remember that part of that social construction is about who has power, and who has power actually shapes the social construction. So these kind of tensions of race being used as a biological variable, not everybody who does that is ignorant to the fact that that's wrong. It's a convenient thing to do, and it allows people to do things that they ought not or would not be acceptable under other circumstances. So this is now where I get to the way forward, and I really believe that one of the fundamental things we need to do is shift that power dynamic and move the power over data and data use to the people who are represented in the data, because that's how we're going to be able to move back to where we can use data for good and do as much as we can to avoid having data be used in bad circumstances. I think that there's a moment now, this also has been growing over the past 10 years, this idea of more involvement of the public in decisions and policy making, policy involvement. So this is a spectrum of involvement of the public, and we can go everywhere from we bring people together and we inform them about what's going on. So that's more just a communication channel. We might consult people, ask their opinion, but we can actually move all the way over to the right, where we say, actually, you, this group who has these data collected about you, you get to decide who gets access to your data, under what purpose. You have a say in how those are interpreted. You have a say in how they're disseminated more broadly when analysis is done. And so if we're really truthfully and well interested in making a difference in race-based data collection, I think the only way that we should be thinking about that is by empowering people. Now, I don't want to underplay the importance of regulations and legislation, because they absolutely set the framework in which all of us work. And they set at least a minimum standards for things, and they can do, we can have legislation like Avi was talking about, anti-genetic, anti-discrimination in the genetic world, all sorts of things that we need to have in place, but that's not going to be enough. Okay, so this is my last slide and just some key points here. So race is not a biological construct, but it certainly can identify different experiences and different needs. So it's important to understand, but it's really, really also important that nobody be allowed to use race to interpret data in a way that is, well, that will be harmful to either individuals or communities. And there is potential harm, but there's also potential harm in not having such data available. And that's one of the pieces that we in Canada really, really need to address right now. We need to focus on the uses of data, given that collection in some cases is well beyond our control. We do need the strong legislation and regulatory and policy structure. And really all of this, as I've said, has to be driven by the perspectives and a true transfer of power to the people who are representing the data. And I will just end by saying that that is particularly with attention to people who are outside the quote unquote norm. And that's all from me. Thank you.
Thank you so much, Kim. And speaking about from the university's perspective, I think that control and power over information and knowledge and data is presumed that it's the best in the hands of experts. And I think I appreciate you're challenging that as well, and that it's important that the communities who are in some sense being represented in the data. Again, as an historian, there's a reason why we could round up every Japanese Canadian, within months. It's because the data as to where they lived and how to have how to get all these people and remove them, many of them forever from the West Coast and from British Columbia. That is in some sense what you said, a very real life example of how data can be used to achieve aims that are incredibly detrimental to the people. As a segue on, we're really very honored to have our third speaker, Marilyn Slett, who is a citizen of Heiltsuk Nation, as well as the elected chief councillor. And Joyce is putting up her slideshow, but Marilyn is going to bring some of her particular perspectives on, again, in particular, how Indigenous peoples have both suffered and from data collection, as well as the importance of being able to collect data and who again has say over its use and who should it be shared with. So thank you, Marilyn, for joining us and helping us learn.
I just want to say before I get started that it's a real pleasure to be here and to acknowledge the two previous speakers on their presentations. It's very thoughtful and thought-provoking in these times. My name is Marilyn Slett, and I'm the elected chief councillor of the Heiltsuk Nation, and we're located in Heiltsuk territory, and it's also known and referred to as the Central Coast of British Columbia. We're a rural and remote community, only accessible by boat or by plane. And it's also referred to by many as part of the Great Bear Rainforest. I have a presentation here today that will speak to our present day experience around information and information sharing, with the current coronavirus pandemic. So I'm also being assisted with my presentation here with the slides. So we can go to the next slide, thanks. So I want to start off with a bit about the government's refusal to share really critical health data and how that is an example of systemic racism. The government has refused to share really important health data information with Indigenous communities throughout the pandemic. And this is, one of the most recent examples of systemic racism. Historically part of the broader pattern of such racism in government's approach to information collection and sharing with Indigenous nations. I want to share part of that includes things like child welfare, the numbers that we weren't ever really able to really quantify in terms of the missing and murdered Indigenous women and girls because of the lack of data or the data not being shared with Indigenous communities. So, the lack of that information is really put into, it's put Indigenous lives at risk, and we really feel strongly that not sharing some of the information, the health data around COVID also, runs that same type of theme. So the next slide. So we have requested numerous times information on the proximate cases of COVID. And, I had mentioned earlier that our community is a remote community. We have one hospital here in the community. It has 10 beds. 6 of them are long-term care patients, elders from our community and a surrounding community that live at the hospital. And, we also have, we're about an hour and a half away from Vancouver by flight. So anybody that needed to be airlifted out of here would have to, be airlifted out by air ambulance. And that's also weather dependent and also based on availability. So for us, the conditions that we have in our community around limited health capacity and care in the community really came, front and center when the pandemic, started really becoming, a global issue. And we began with, sending out requests to the province and to other health authorities about sharing information around the proximate cases, because for us, it would indicate, our community response, and it would also provide us with, being able to make sure that we're doing things in an appropriate and efficient manner in terms of keeping our community safe. Next slide. So, we have surrounding communities, on the coast that we've been working with in terms of, emergency measures. We've, I'm not sure, maybe some of you might be aware, but we've, going back into mid-March, had travel advisories, travel restrictions, and travel bans into our community. And we had to take these, blanket level type of emergency measures because we weren't being able to access information around, where the proximate cases were, in and around, the Central Coast. Many of our communities have small populations and members who live in close proximity to one another. And, I had mentioned our limited medical resources. We have homes in our community, we have a real housing shortage and crisis in our community that we are working to address. But at this present time, we have some homes that have multiple families living in, in one household. I know one of my colleagues, over the past year has had up to 17 people living in his home, different family members. So, for us, being able to effectively respond to a positive COVID case in our community, it's critical that we're being provided with this information in a timely manner. Our nation has a significant number of elders. We have 220 elders in our community, and they are at risk of contracting, you know, and dying from COVID-19. We're not, you know, we have a history of pandemics in our community. You know, we went from 2,000 people to 200 people, you know, in the early 1900s, late 1800s. You know, so this is something that, you know, is passed along in the living memories of our community. So the other thing I wanted to mention about our elders is we have about 30 of them that are over the age of 75 that are the last of our fluent speakers. We have other young people that are doing a fantastic job at learning the language, but fluent being born, you know, with Helsik being their first language, you know, and fluent, you know, from a baby, you know, to being an elder that they are, you know, in our community. So, you know, for us, it was about protecting our elders, protecting our way of life, protecting our culture, and, you know, making sure that, you know, we keep our elders safe as we, you know, so we can all come out of this pandemic together. Next slide. One of the things that we've mentioned to government and provincial health agencies, by not working with our communities, it really does leave us in the dark in terms of being able to proactively respond to keep our communities safe. You know, and I had mentioned our travel restrictions and our 14-day self-isolation requirements in our community. You know, and without that adequate information, you know, it really does make it difficult for us to be able to, you know, make sure that we're responding in a way that, you know, keeps our community safe, and that, you know, we're expending our limited resources in a way that supports, you know, our community as a whole, and that it's not a reactive response, but a proactive response. We can't effectively exercise our rights and governance powers and protect our communities without sufficient information, without, you know, having that information around the proximity of COVID-19 cases. It's been really difficult. You know, we're, you know, a few months into this pandemic, and we know that it's not over. You know, there is no vaccine, there is no treatments. You know, there's, you know, the second wave that, you know, may happen, you know, in the fall. And we have this small window of time right now that we can set the table for really having, you know, these conversations with government, with Indigenous communities around sharing that information with us. And one of the things that I wanted to, you know, to highlight, sharing information with an Indigenous government is not making it public. You know, it's sharing it with us as a government-to-government responsibility. We are legitimate governing nations, Indigenous communities. We have 700 generations of you know, evidence here, you know, being on the Central Coast, being in Helsik traditional territory. We have, you know, governance systems that are alive and well with our hereditary chiefs. And, you know, we've lived through, you know, these pandemics, and one of the reasons, you know, I'll share with you about Helsik, you know, we're an amalgamation of 5 tribes. And that amalgamation was also a result of, you know, our tribes almost being decimated with the earlier pandemics, you know, of the last couple of 100 years. Next slide. So, we've been, reviewing and talking about the policy of non-disclosure as an example of systemic racism. The government's policy not to disclose information with us, is, it's a contemporary example of systemic racism. The policy suggests that, the government is acting on the basis of stereotypes and misconceptions about Indigenous governments, and, implying that we can't be trusted with this information. Yet disclosing information to our governments is not the same as disclosing to the public. We have set up an emergency operations center here in our community, made up of 10 people. And we have developed and put together a surge center in our community. It's in our community school gym that, will be able to provide, resources for, should a, COVID case happen here in our community, for people to receive that care in our community before they have to be airlifted out. And, we've taken a real proactive response to, the COVID-19 pandemic here as much as we can without having that full disclosure of information to our community. Next slide. So, the government, continuing to retain that control, with that information, and, telling of Indigenous, telling that Indigenous story for us, instead of acting with us, is, one of the, it's a bit of a, paternalistic approach, in terms of, working, I guess to paraphrase, I think it would be best to, maybe share a bit about one of our elders. We were talking about, information sharing, and this was our HEMA's Harvey. And he said, in this day and age, we should have information at our fingertips. We should not be at the same stage we were, with the last pandemic that hit our community, and sadly, we're not there, because, of policy or privacy. And, it's been indicated with Premier Horgan's recent radio interviews, with the First Nations Health Authority reporting on, COVID cases in BC after, a lot of prodding and requests from our communities, to obtain that information. Our communities can tell our own stories, and our communities can govern, our communities, with the laws that we have and the laws that have sustained us over time. Next slide. So this really is a contemporary example of a broader historical pattern of systemic racism. And, I had shared that, we had, seen this, throughout history with past pandemics. And, it's also true with the 1918 Spanish flu, where the government had a different relationship with HALSIC at the time, but still maintained control of information and dialogue, in a paternal manner. We have stories of that Spanish flu pandemic here. My grandmother was 9 years old, was born 9 years after the Spanish flu, and remembers, sitting around with the ladies, with her aunties, and, they would, sit around the table and talk about, what had happened with that pandemic. And there were literally households of people dying. And there was such fear and chaos in our community that, there were no time for proper burials. There were no time for us to carry out our mortuary customs that, that we have as HALSIC people. And although we haven't had a case here in HALSIC territory, the COVID-19 pandemic has certainly left its mark on how we, carry out our customs as people. And we had, since March, for our community, 18 people that had passed away. Some, that live in the Vancouver and urban areas, and some that live here in our community. And we take we're of the mindset that you're house sick no matter where you live. And so many of these families and people wanted to come home for, their loved ones' funerals here in the community, or to bring, people home to be buried here. And we were unable to carry out those mortuary customs due to, the orders, in the community around, gatherings and that sort of thing. So this whole pandemic has had such an impact on our way of life, and how we do things. And, so, we look back to the past pandemics, and we look back, and we can look at this one clearly with the impact that it's had on just who we are and how we carry out our life. Next slide. So, we are, really we're at a point in time where, there's such a potential for a turning point in how we can do things together and how we can work together with provincial health authorities and the province and the other regulators, that are out there, and, working with our communities here. We know that we have, this small window, before a potential second wave. And it really presents, to government an opportunity to do better, to move away from that systemic racism inherent in the approach that's being, carried out right now, and to work with Indigenous nations to keep our communities safe. We require, working together, them working with us, with our Indigenous governments, to share that information, to share that data, to ensure that we can adequately be informed and empowered to, exercise our self-government and our inherent right to, keep our community safe and to govern in a way that we have, since millennia. This photo that you can see here was taken last October in our big house. This is the first big house that we have built in the village of Bella Bella in over 120 years. So this is the first big house that we've had since that prohibition against our culture was lifted here in our community. And, we had a big celebration, and you can see this is actually a potlatch that we opened our big house with a 5-day potlatch actually, but and it was filled, it was absolutely filled. We have members that came from Vancouver, neighboring communities, and people from literally all over the world that came to celebrate with us. But potlatches are, for us, it's how we carry out our laws, and it's how we carry out our oral traditions, and it's every part of who we are as House of People. And, one of the things that, and I'll just kind of end with a thought from one of my staff members. She had posted a photo of the big house during the first few weeks of the pandemic. And she said, we're self-isolating and we're staying home, to keep each other safe. So when we gather again in our big house, nobody will be left behind. And, that's really speaks to the work that we do as Indigenous people, to make sure that as a collective, we are safe and we are doing everything that we can to keep our communities safe. But when information is withheld from us, under the guise of privacy, or stigma, it's a bit ironic because, going, and just paraphrasing another elder, a traditional knowledge keeper here, she said, we've lived with stigma all of our lives, so, this is something that, we need to be able to do better. BC has adopted, legislation upholding UNDRIP. And, I think that, with being in the era of reconciliation and recognition of, Indigenous peoples, we need to be able to do better. We need to be able to do things as a collective, government to government. So I just want to thank you for an opportunity to share from a holistic perspective, the importance of information sharing and the collection of data. The lack of it, will have a negative effect on us in terms of, being able to proactively, respond to a pandemic. But it's also been our experience too, just in terms of, not having that data, thinking about, all of the women from our communities that have gone missing and, been murdered outside of our communities, not even having a data set that is conclusive on that in this day and age is an absolute crime. It should not even be something that we're talking about here today. So, as a collective, I really do appreciate, sharing some space with all of you, because we all have, commonalities and things that we can do, together to, to change this narrative going forward. Thank you.
Thank you, Marilyn. Thank you so much for sharing the perspectives of yourself, but also of Heiltsuk Nation. And I think, really highlighted one of, I think, the important themes of actually white supremacy and colonialism in Canada, and that's long-term effects of the systemic racism, which we still live with, which is the great irony to me. I was born here, as a guest on the land of Hunkaminam speaking peoples and of Tsleil-Waututh and Squamish. But I spent 15 years working in the United States. And one of the great ironies of this moment, of course, is that the United States, in their collection of race-based data, you're able to see the differential impacts, and you're able to see that Native American communities and reserves are suffering differentially, that there are many non-white communities that suffer much greater rates in terms of COVID. And it leads me to think about one of the things that, as a historian and perspective, is that in Canada, it's so much more difficult, actually, to deal with racism. And precisely because you have to spend so much of your effort first to prove that it even happened to you. And so with recent anti-Asian violence and anti-Chinese violence, verbal assaults, physical assaults, you've got to do the work of counting up, the incidents of assaults just to prove that there is racism. And I always say, in Canada, one of the difficult things, you got to prove racism exists before you even deal with it. And so as advocates, as communities, this idea that not having the information, not collecting it, this idea that we're colorblind in Canada, that we don't see race, well, that makes it much more difficult for those who suffer from white supremacy, from being racialized. You have to prove that they're being racialized, and they have to prove to someone who says we don't have racism here, not like the U.S. And so, thank you so much for reminding us of how foundational that system of colonial knowledge collection and use, prove, share, given the access to the information in this way, as you said, kind of paternalistic. You don't deserve the information. You won't be able to use it properly, and therefore we're going to keep it from you. But one of the rationales for that, from a historian's point of view, is precisely so that you have to figure it out yourself. You have to prove what's happening to you beyond a shadow of doubt to the people who actually often have the information already. So thank you, Marilyn. So that I want to open up for the other panelists to actually to kind of respond to each other as well, and to pick up on some of the themes. I'm sure most of the people who are online right now have seen some common threads go through all three speakers. But maybe I'll go back to Avi, since you opened it up for us, to just to get some of your reactions to what Kim and Marilyn have said.
Sure, and I guess I'm reacting more strongly to what Marilyn has just said. It's just so powerful, and it really resonates with what we have been experiencing. And then, as Henry has pointed out, that it is so hard to talk about racism in Canada because the government doesn't even want to acknowledge that it exists. And one way of continuing to deny its existence is by not collecting data. So, and it's like, it's just like a cycle, it goes into a cycle. And I recently actually did another webinar as well, like, sort of with the African Canadian community, and they had a webinar with the chair of the Canadian Human Rights Commission. So I raised the question similar to what Marilyn has just said. Can we argue the government's refusal to collect data constitute a form of racism in and of itself, and file a complaint with the commission, on that basis alone? Because I totally agree with everything that what Marilyn has just said. And that paternalistic idea is that, it's like we are protecting you from yourself, or we are protecting you from the data for fear that some other people will misuse it. Well, the problem is we don't even have a choice to decide whether it's good for us or not, right? Like that decision is made for us. And I think it's very so it's very unbelievably paternalistic, but I think it's just hide behind the real purpose is to not address the issue of racism in Canada. And that really is the real purpose. And I think, but interestingly, with the government of Ontario kind of pushing the data collection and kind of using it as an example of the good work that the UN also has in its report about Canada, in a number of recommendations already talk about the importance of collecting race-based data. So I think that really, I hope that addresses many of the concerns out there in our community, but also concerns from people about, it's better not to collect because somebody else may misuse it. Let us decide, let us have that choice of saying that we want the data, and we will find a way to prevent its misuse.
Thanks, Avi. Kim, I really appreciated how you brought up from that research point of view about who's, how do you empower those who are actually the subject of the data collection itself, and any sort of reactions and thoughts that you have right now.
Yeah, so I'll be really quick because I hope we have a chance for some questions. But I mean, I think just drawing on some of the things that Marilyn and Avi said, stereotypes exist with or without data. So we're not really protecting anybody from anybody by not being able to show formally. But you need the data to create evidence, and you can't execute your rights appropriately in the absence of evidence and or data. So it's all kind of wound up in the same thing about self-determination and community power and that sort of thing. And I do agree that there's a certain strain of denialism in not collecting race-based data in Canada as if that means that there isn't a problem, or there isn't a problem and therefore we don't need the data. But I think that there is at least equally a very strong strain of paternalism in the sense of we actually know, I mean, well, I don't need to say more because I think Marilyn just nailed the paternalism throughout her entire talk. So I think both of those things live side by side, but we need to make the claim that data are fundamental to human rights and that exercise of self-governance.
Thank you, Kim. Marilyn, I know that you yourself have just spoken, so I don't mean to come back and ask you to say more, but but to give you the space again for any other thoughts other than those very powerful points you've made for us.
So some of you might be aware about there was a mayor in Alert Bay that had self-disclosed his positive COVID case. About 8 weeks ago, early on in the pandemic. And, from that one case in Alert Bay, which is just, it's a community that's in close proximity to us, it turned into 29, very, very quickly in that community. And, they had a loss of an Namgis elder, as a result. And that really hit home for us. We know a lot of people in Alert Bay with the Namgis people, and communities on the coast really went into high alert, when that happened. And without having the information and without the health authorities providing any information to us, you'd seen it all over the news, the blanket, travel bans that we were, enacting, and we were one of them, and we continue to have, a no tourist, no visitor ban in our community and in our House of Territory right now. Normally, we would see hundreds of, recreational boats, every summer traveling through. And, sports fishing lodges, would be, gearing up to open, now and, right up to, October, late September. So, we, without the, basic measures being met in our communities, we had, let the province know that we need a rapid tester in our community. COVID tester. We need to know that the province, as part of their restart plans, has had proper screening for people that are going to be traveling to remote communities where healthcare is limited, and that and then of course the big thing that we've been talking about here today, around sharing that information with our communities, so we're prepared and able to, respond in a proactive way, to protect our community. And, we've hired our own member as a contact tracer that works with our community, in terms of, movements in and out of the community, but also to work with, surrounding communities around, any possible threats to our community and that sort of thing. But these are all things that we've done on our own, without, we had, looked and reached out to the health authorities about, training for a contact tracer. And, there's, support, in a general way, but nothing in terms of, helping to, provide that training and capacity. So when we say we're being blindfolded as we're, trying to respond to a pandemic, it's literally working in the dark.
Thanks, Marilyn, for that. I'm tempted to again sort of almost have this recorded and have people watch it again, so that so many of the points that you and Avi and Kim have made can kind of sink in, because we've gone through a lot of different topics, and we've heard about why the data is so important to have, but also I think each of you has also alluded to why you think it hasn't been collected, and when it has been, why it has not been, in some sense, shared in a collaborative manner with those who really are directly affected by it. So actually, I wanted to open up to a couple of people I know who are listening today, including one of the co-organizers of the panel who thought through some of these issues, who wrote also a trio of very thoughtful pieces for the Tyee, and it's my colleague John Price, who's emeritus from UVic, but as a fellow historian, and I know that he may have some things to say also about this question of why don't we collect the data, and so I don't want to put John on the spot, but it sort of hangs in the air after each of your presentations, and I think it is one that we really ought to ask ourselves. And I know I've been asked many times, well, why do they collect this in the U.S. and they don't collect it here? And although there's a complex answer to it, I think, Marilyn, your remarks right now, and as well as Avi's, perhaps are more straightforward answers as to functionally why not collecting it, works for some people. So I'm taking a quick look. So John, if you want to have anything to say, feel free to flag with a hand and join in. But I'm also looking at some others that. So we have a couple comments and remarks, including a question that I'll go to in terms of. Okay, does the police, this is from Daniel Lee, does the police, RCMP, keep records of racial attack complaints? I'm very curious, as I don't feel they deal with these complaints properly. That's a really good question. And I'll just say that on July 23rd, we'll have folks from Project 1907, who are one of the groups locally here who gathered the data. And again, that irony of the people who are suffering the attacks needing to gather the data themselves in order to just prove how widespread this was. But we'll have the folks from Project 1907 on the 23rd. But I do know that Avi, you are part of groups over in Ontario that have been also, collecting and maybe there's a way. I'll put the question to you in terms of thinking about police and attack complaints and things like that in terms of the anti-Asian violence recently. Avi.
Sure. Yeah, okay, yeah, so the answer to that question is that I don't believe that, well, first of all, the police would only have data if people report to them. A lot of these incidents are actually not reported to the police. But once the police report, I don't think they, if I understand the question properly, I don't think they collect the kind of data that we want to see, right? So, for instance, I don't think that they will have data that would say how many Chinese, how many, people of Chinese descent, Indigenous people are reporting this type of attacks during this period. I don't think they have that kind of a breakdown, particularly, although they would have information to say, for instance, that as a groups, which groups are more, have filed more police reports based on hate crime. But the crime itself needs to be identified as a hate crime by the police first. So a lot of these crimes, even if they are reported to the police, they may not be reported or recorded as hate crime, first of all. And second of all, many of these incidents would not have been reported to police. I see that John is, maybe he wants to respond to your earlier question.
Thank you, Avi, and I'm also very cognizant that Marilyn, you mentioned in particular murdered and missing women, and some of not actually having data shared with you in that sense. So that's another, I think, aspect of what kind of information is collected, how is it aggregated or not aggregated or disaggregated. These are actually quite important questions in terms of policing. I think as you've raised, Avi. John, I wanted to give you a chance, and for those who are expecting that this was a 90 minutes and we're going to end let me say as a poor moderator that that if you know, I will ask our panelists, if you don't mind, a few more minutes, just sticking around, and again, those who need to sign off, you know, please do. But maybe just a few more minutes, just to further the conversation before before we end. But John, I want to give you the chance, since I kind of invoked it and brought you up, to say a few words as well.
Thanks, Henry. Can you hear me? So yes, thank you very much to the presentations, Avi, Kim, and Marilyn. Really fantastic. And Marilyn, thank you very much for your powerful words. I want to say that I just want to echo that. You know, I've had the privilege of working with the Moachat Machalat First Nation for the past 5 years, and was just up visiting with the elders in March. And they have not been able to meet together throughout the pandemic. And so the costs and the vulnerability of the community is something that you can really sense. So just to say that that particular difficult situation that Marilyn described, I think applies to many other Indigenous communities. And so just to add that, and a couple of points very quickly about data collection. One is that you know, governments have been collecting data, whether it be race-based or other data, forever, whether it be census data or whatever. And you know, just to give two examples of this, was how they use that data. In 1940, the Department of Trade and Industry of the province of British Columbia was keeping track of craftsmen's or craft people's licenses. So these are boiler makers or whatever. And what they did was, at that time, they kept a specific file on all people of Japanese heritage who had these craftspeople's licenses. And they then forwarded those to the Attorney General, because supposedly these were examples of, they were part of the process of what they called Oriental penetration of the province. And of course, that information was then used as part of the expulsion of Japanese Canadians in 1942. And the same thing with the tax people. Right? The provincial tax people were keeping track of all the records, and they kept the records of people of Japanese heritage who held properties and paid taxes. And then they used that information and forwarded it to the federal government in order to dispossess Japanese Canadians. So that data can be used, whether it's racially collected, it can be filtered, right, in a way that's used for very nefarious purposes. And so I think that, of course, there still are dangers in collecting race-based data, but I think there's nothing to lose in the sense that they're already doing it, have done it historically, and so now it's a question of people of color, Indigenous, Black, and people of color being able to have access to that information and being able to use it as a wedge against racism and for justice. Thanks.
Thanks, John. I really appreciate that, and echoing a point that I think all three speakers have made, and in particular in Kim's slide of it's not in some sense about the collection. I think I've heard many people talk in the recent weeks about we shouldn't be doing this, we shouldn't collect this way, and it's like it's being, and Kim, going back again, Kim McGraw's point is being collected anyways. It's who's using it and for what purposes that are the questions really that need to be talked about today. And I'm mindful again that we are over the time, but I do see that there are some other questions, but we will save those. But I did want to respect the speakers' generosity and in sharing their time with us, and not to ask too much of them. But I wanted everyone to join me in thanking you know, Avi Go and Kim McGraw and Marilyn Slett for sharing their perspectives, their insights, their knowledge, for sharing the data that's that they've collected in their heads, so to speak, and the knowledge that they've observed in their own lives, and in the very actually crucial positions that they've played, as advocates, as community members who really have done much for others and are speaking tonight on the behalf of many others who I think we would appreciate greatly. So thank you to them. Again, this is a conversation, and I think many of the themes and issues and questions that were raised by AV and Kim and Marilyn, I think will be, again, picked up on July 23rd. Again, looking at those, we benefit. There's a bit of a family business going on here in terms of we have AVGO's sister, Amy, who will again bring us some perspectives from central Canada, from Ontario, and pick up again on some of these. Our ability to talk about this, not just in British Columbia, but also nationally, I think is important. But I really do appreciate the particular perspectives that AV and Kim and Marilyn have brought to us tonight. We'll post the questions. We will. This is being recorded, and so we'll post this up as well. So again, the speakers on July 23rd will have seen this conversation as well, and so we hope it's a kind of continual dialogue that will pick up. I know that some of you from, talking about data from your registrations and your emails that you registered with, we do have, I know some folks who have provincial government email that they used for the registration, and as well as from public health authorities and from universities. I hope that a lot of the things that came up here today give you something to think about as we in BC move forward and try to adopt some of what I think has already been adopted in Ontario as we consider the approaches that Ontario has taken. I would also urge our colleagues in higher education at UBC, at SFU, at Langara, and at the University of Fraser Valley, at Vancouver Island University, all of those who are on the research end to also think about some of the issues that were raised tonight and how we can actually think about the ethics of research and sharing knowledge and really decolonizing knowledge and how it's gathered and how it's used. And really it's more about its use is one of the big things I've heard tonight from all three speakers, that the use is actually the thing that we really need to be dealing with. Who needs information and who benefits the most from not sharing, and who suffers the most in terms of a society that really hasn't gotten rid of in any way the legacies of white supremacy and colonialism, but we still live amidst that. So thank you, all three of us. Thank all of you for coming virtually to this conversation. I think just in coming, you've shown a kind of commitment to tackling and dealing with these very difficult issues. I want to again thank Carolyn Wing and Langara, the CCHS, Chinese Canadian Historical Society of BC, the Sun Yat-sen Classical Chinese Garden, Vincent Kwan, the director there, and Joyce for helping the back-end logistics of keeping us all, getting the slides up, keeping us all from disappearing virtually. And again, thanks again to all the speakers for joining us. Yeah, and we'll see you on July 23rd. So many thanks. And many thanks, Marilyn, for, even though you didn't have to travel from where you were, still you've traveled to us virtually. So thank you for coming from afar through Zoom and for preparing a wonderful and powerful presentation that fits so well with that of AD and Kim.
Thank you.
Thank you, everyone.